Oh.
You muted yourself, Chairman. Mr. Chairman, you muted yourself.
Hold on, if you guys could hear me.
Okay, I can hear you now.
Hold on a minute here. We're having a little technical difficulty here. Can you guys hear us? Because we can't hear anything.
Yeah, we can hear you.
Someone talk?
Yeah, we can hear you, Mr. Chairman.
Hey, you hear?
Yeah. All right. So I don't know what you guys heard and didn't hear. We have a substitute, Representative Mazzaki for Representative Butler, and a letter.
I believe the clerk called the roll.
Oh, we did the clerk call the roll? Were you able to hear what we said?
I did hear you. I called you. I just called your name, Mr. Chairman.
Here?
Andrade here too.
Davis.
Present.
Wheeler.
Here.
And I heard you, Representative Andrade. Bourne.
Here.
Brady. Buckner.
Present.
Carroll.
Here.
Davidsmeyer.
Here.
Evans.
Here.
Gordon Booth.
Here.
Hernandez.
Here.
Ramirez.
Here.
Spain.
Here.
Mazzaki.
Here.
Okay, I have 14 members responding to the roll.
All right, we have a quorum. We're ready to get started. We're going to start with Leader Harris on House Bill 307. Motions to concur on Senate Committee Amendment 1 and Senate Floor Amendment number 2, I guess, right? Floor 1 amendment 1 and 2? Yes, so Senate Committee Amendment number 1 and Senate Floor Amendment number 2. Leader Harris?
Yes, thank you, Mr. Chair, and I would like to move to concur with the Senate, and what this does is create the second 2021 General Revisory, which corrects different errors in punctuation and numberings and clarifications within the compiled statutes. Be happy to answer any questions.
Okay, is there any questions from committee members? It looks like Representative Wheeler, your hand is up.
Thank you, Mr. Chairman. Leader Harris, if you could just walk us through a little bit more depth of what you just said there. I want to make sure I understand just what the bill does, please.
This is updating and clarifying the compiled statutes to make sure that they conform with all the laws the General Assembly has passed. It includes any typos, clarifications, and renumberings of lines, additions of punctuation, and etc.
And that sounds like something we should get done. So thank you.
All right, seeing no other questions.
Witness slips.
We have, I'm going to have Vice Chair Davis read the witness slips for the record.
Okay, Mr. Chair, we have one proponent, and that is Martin Leal. That's one opponent representing himself. We have 8 opponents. Anthony Leal representing himself, Kathy Mudd, self, Colleen Cagney, Glenn Brown, Jessica May, self, Lisa Nidziela, there we go, Nettle Jada, and Richard Nidziela. Excuse me for butchering those names. No position on the merits.
It's almost like I knew the names. Okay, seeing no other questions, Representative Davis moves to recommend that the motions to concur in Senate Amendments number 1 and 2 to House Bill 307 be adopted. Is there leave?
Yes, Mr. Chairman, there is leave.
All right, with leave being granted, is it 14 voting yes, no one voting no, no one voting present? This measure will be reported to the House floor.
Thank you, Mr. Chairman, members of the committee.
All right, next we're going to move to Leader Jay Hoffman, Senate Bill 1139. You got House Floor Amendment number 2, correct?
Yes.
Okay. Would you like to proceed?
Yes. Thank you, Mr. Chairman, ladies and gentlemen of the committee. This bill is the omnibus TIF bill that we generally do every year. It contains an initial 12-year extension from 23 to 35 years for Homer, which is in Representative Holbrook's district, Greenville, Representative Myers district, and the Kinsey Industrial, Northwest Industrial, Pilsen Industrial, 35th and Hallstatt, Pulaski Corridor TIFs in Chicago. It also contains an additional 12-year extension from 35 to 47 years for Belleville, which is in Latoya, Greenwood, and my district, and Pekin, which is in Representative Luff's district. I know of, and all the letters of support have been received by the taxing districts.
All right, Vice Chair Davis, will read the witness slips.
Okay, we have 2 proponents, Patrick Hall representing the city of Chicago and Thomas Henderson representing the Illinois Tax Increment Association. We have 11 in opposition, Brittany Sherman Rains, Charles Riders, Christine Hassel, David Floyd, Jeff Littner, Jody Dawson, June Riddens, Lucia Floyd, Natalia Floyd, and Sandra Sapizek. No position on the merits.
All right, seeing no questions from the committee members, Representative Davis moves that House Floor Amendment number 2 to Senate Bill 1139 be recommended for adoption. Is there leave?
Yes, Mr. Chairman, there is leave.
Leave being granted of 14 voting yes, no one voting no, no one voting present. This measure will be reported to the House floor.
Thank you, Mr. Chairman, ladies and gentlemen of the committee.
All right, next we're gonna move to Representative Faulkner and Senate Bill 1784.
All right.
Looks like you got House Floor Amendment number 2.
Yes.
If you'd like to proceed.
All right. Thank you, Chairman Rita, Vice Chair Davis, Spokesperson Wheeler, and the entire executive committee. Thank you for obliging me today as I present House Amendment 2 to Senate Bill 1784, which is now the vehicle for the Chicago Elected Representative School Board trailer bill. This bill does a few very straightforward things. In the current law, there's a requirement for an independent financial review and report. The new language in this trailer bill will require the independent financial review and report be due no later than October 31st of 2022. And will require SB to provide its subsequent recommendations about the report to us, the General Assembly, no later than July 1st of 2023. The difference is that date has moved up from a date of June 30th of 2025. The current law also contains a moratorium on school closures that spans from June 1st, 2022 until the elected school board is completely sworn in. This new trailer bill moves the date that the moratorium begins to an effective immediate date. The current law also neither explicitly provides for board member compensation, nor does it explicitly provide that a member shall not receive compensation. During the House floor debate in June, Leader Ramirez indicated that the intent was that the board members would not receive compensation for serving on the board. The language in this bill makes that promise explicit. The trailer bill also extends the date in which the electoral districts must be drawn from February of 2022 to July of 2023. It just gives us more time based on the calendar. It replaces some specific dates in the bill that became law with some general date references. So instead of saying, for instance, November 5th of 2024, it says general election of 2024, just to make sure that we've got that piece hammered down. And there's also some very small drafting errors that will be cleaned up. One other piece of the bill that I should mention to the committee is that the original bill gave the Chicago City Council the responsibility to advise the mayor about nominees on the hybrid board and the authority to consent to those nominations. In this trailer, the ability to appoint members of the hybrid board that will exist until the completely elected board stands up vests completely with the mayor. We think it's important to have a smooth and effective transition to a fully elected school board like the ones that exist in every other district in the state, but we also don't want our students to suffer as this transition occurs, and finding ways to streamline the process was extremely important to us, so we removed that barrier. This is the product of the hard work of a working group who convened multiple times over the summer to hammer out the issue.
Hey, Mr. Chair, I think we've lost connection here.
We're here.
All right. What did you guys hear the last thing I said, or did you guys miss me?
We did not hear your last thing you said.
Okay. The last thing I said was that this is a product of the hard work of a working group who convened multiple times over the summer to hammer out issues, and numerous meetings were had with the coalition of stakeholders, with representatives from the teachers union and from the city of Chicago. This gets us closer to a more effective and a better Chicago elected representative school board, and I'd be happy to answer any questions.
All right, thank you. Could the clerk add Representative Brady to the roll? And
Want to do witness slips, you guys? 9 opponents, 185 pro.
Vice Chair
9.
Davis for the witness slips.
Well, Mr. Chair, we have 9 proponents and 185 opponents. Do you want to ask for permission to waive the reading?
If we could waive the reading of the witness slips.
Actually, Mr. Chair, can we just have like a little sampling of the 185 of exactly, are they constituents, is it organizations? Just give me an idea, if you would, please, of the opposition.
We'll run it through the randomizer right now. And
Okay,
we'll fill out a few.
So in the proponents, you have the Illinois Federation of Teachers, Chicago Teachers Union, Illinois, AFL-CIO, City of Chicago as a random group. And as far as the opponents are concerned, Representative, they all appear to be there's the Madison County Conservative Caucus Corps, New Bethel, Church of God in Christ. Other than that, they all are individuals, Representative Wheeler, excuse me. All individuals.
They come from the city of Chicago primarily, Will, or is it kind of
it's hard to tell. It's hard to tell. Seems like it's probably mostly from the city, but there is nothing that specifies that they are from the city of Chicago, the majority of them.
All right, thank you.
Is there any questions from committee members?
I have a question. That's Dan Brady. I came on late. I'm sorry. But what's this bill number? I haven't gotten it yet.
1784, right?
Senate Bill 1784, we did add you to the roll too, Representative.
Thank you.
Mr. Chair, I got a question, if it's okay.
Yes.
Representative Buckner, I want to understand, I guess one of the things that I found interesting in your presentation was that your group chose to take away the advise and consent portion of the city council. Can you elaborate a little further on why that was an important step for what the committee's work was?
Yeah, well, so as we looked at what the transition would look like, obviously there's a staggered transition, and we slowly move from the current appointed school board to a fully elected school board in 2027. There will be a point where there will be a number of members on the board who are elected, and then also a number of members of the board who will be appointed, right? So there's that hybrid piece. As we looked at just making the smoothest transition that we could as we move towards that election date, we want to remove any hurdles that may exist to kind of bungle up the work that we were doing. So it wasn't anything kind of ideological, right? It was just really about process and smoothing out the process.
I guess that you're speaking to the question for me is it a process because the city council could be somewhat unwieldy when it comes to choosing people for this kind of an important position that may not be in harmony with the rest of the city council. Is that kind of the flavor of what you got?
In other situations where the city council has had advise and consent power, usually with police chiefs, there hasn't been a bunch of issues, but listen, we just want to make sure that there were no real roadblocks here, either just to make this smooth. Yeah,
appreciate that. Thank you, Mr. Chairman.
All right, thank you. Is there any other questions? I don't see any other hands up.
And Chairman, I think I also want to just put on record my assumption, and I'm not sure, but my assumption is that many of those opponent slipped for the wrong bill. I think they saw the former legislation that was on this bill number, and that's where they may have come from.
Okay, because I was going to ask, can you give a little bit of background why maybe there would be so much opposition? But what was the underlying bill? Maybe that could help us.
I don't even know what it was. Honestly, it was about school athletic uniforms and giving people the ability to have more modest, I think, dress if it was a religious exemption. So,
all right. Seeing no other questions, in the way we have Representative Davis moves that House Floor Amendment number 2 to Senate Bill 1784 be recommended be adopted. Is there leave?
I will go with partisan leave, Mr. Chairman.
So we got partisan leave for House Floor Amendment number 2 to Senate Bill 1784 with a vote of 9 voting yes, 6 voting no, no one voting present. This measure will be reported to the House floor. All right, we're going to stand at ease here for 1 minute or a few minutes here. We'll be right. Just hang on here a minute. All right. Can you hear us? We're going to move to now our last bill of the evening. Leader Gable with Senate Bill 1169. For the record, there's witness slips. There's 665 proponents, 48,968 opponents, and 463 no position of the merits. We're going to ask for waiving of reading all these.
And Mr. Chairman, can we get a little sense, like I asked before, of what exactly
A little
we're
sample.
seeing there with all these?
Sampleizer.
Yeah, just read 10% of them.
10% might even be a little, hold on one second here. While we locate these. It's taken a while to load all these.
How about 1%? That's fair.
It appears they are all the opponents. All the opponents are self, it appears, as he's scrolling through the 48,000. And you could maybe look on your website if you would like to go further into that. How's that?
Mr. Chairman, tell me about the people who've requested oral testimony.
Okay, we have one person that I'm aware of for oral testimony. On the list here, what do we have here? Who do we have? Bob Gilligan from the Catholic Conference of Illinois.
So, but did others mark themselves as requesting oral testimony on the website, but then not take the last step of emailing the request in? Is that what we'd like to do?
So here's how we did this with this particular bill and bills to this, all bills. There's a process that's put on there. It would be impossible to have 48,000 opponents do oral testimony. Bob Gilligan from the Catholic Conference followed what we have in our instructions on how to do oral testimony. Is why I have him on the list here to do that. But there is a process in place that we have for all bills, but in particular when you have a bill with this magnitude of proponents and opponents, we need to follow that rule strictly.
Then, Mr. Chairman, while people figure out what they may or may not have done correctly with their request for oral testimony, I think I'm going to request maybe a roll call vote on the waiving of the reading of the witness slips.
Well, we're going to stand at ease here a second there. All right, so here is I was asking and to see if you had maybe a few others that wanted to do oral testimony. I would allow to add a few to the list here, seeing how important this measure is. The problem is there's no way to get them a link to be into the room to do that testimony if that's what you were looking for. And I'm going to object to not recognize your to reading all these. That there's just too many to read. Okay.
Right. No, it would be okay, Chairman, if we made a motion to read them all and we just have a vote on that.
We're going to stand at ease here. So, I mean, and then in particular, is there someone or two that you wanted to get on to testify? I don't have an issue doing it. The problem that we have is how do I get them the link and how do we get them in the room to do all this? And I'm gonna see if there's if there's some people, because I don't want to cut off some of this. We should air and vet this legislation. But is there someone in particular, maybe you could text me, or a few groups that you may want to have do oral testimony? I don't have an issue doing that. Okay.
I appreciate it, Mr. Chairman. As I get those names, I'll get them to you.
Okay, we're going to stand at ease here for a minute.
Thank you.
Hello, can you hear me? All right. Representative Wheeler, we have an email address. We were working on getting an email address. It's what is
Executive Committee at hds.ilga.
it's executive committee at hds.il.ga.gov. And if they email us, we will try to get a link to them so they could testify. Okay?
I appreciate it, Mr. Chairman, but I still want to at least go in with some of the names on this list here. I don't want to waive the reading of all the names.
Okay, so you want some of the self people.
I want to actually, some of my committee members want to read the whole thing, which I understand why. This is a huge issue that people are really engaged in. So
You guys have a list of these on your computer? I mean, which members would like to read some of these members in?
It's all available all day.
I mean, when you go on your computer, you guys are on the computer there, right?
Chairman, if you like, I'm happy to start reading the names of people who have
We're
offered.
not gonna read every name, but is there some certain ones that you'd like to be put into the record?
I think they all should be
We
put
could
into
do
the
this,
record.
we could do this here. We could make this run very smoothly, get the people that need to testify on the record, or we could do this the hard way. How would you guys like to do this?
The hard way.
All right. Your motion's not we're not taking any action on that. Representative Gable, let's hear your testimony on Senate Bill 1169. No one's going to be able to, we have the one, Bob Gilligan, to testify after Robin gives her a brief statement, what she's doing, and we're going to move forward.
Thank you, Madam. Thank you. Thank you, Chair. Appreciate this. So, Senate Bill 1169 is an amendment to the Healthcare Right of Conscience Act. It is a clarification of existing law, and that is all. We must ensure that the Healthcare Right of Conscience Act continues to protect the healthcare workers' relationship with their patients. That is what that act has always been for the past 40 years. The act was not written to interfere with the ability of employers to implement workplace safety measures during a global pandemic. But that's how people are using it today. The amendment preserves the clear legislative intent, as I said, that has been established over the last 40 years of the existence of the Healthcare Right of Conscience Act. I also just want to be very clear that employers in the U.S. can require employees to be vaccinated as a condition of employment in accordance with both state and federal law. Put differently, employers have the legal right to require vaccination for employees as a condition of employment under both federal and state law. This is true regardless of the Healthcare Right of Conscience Act. What's more, the proposed amendment to the act does not change this fact. Employers still have this legal right with or without the act and with or without this bill, this amendment. Employers' right to require vaccination as a condition of employment is generally subject to the reasonable accommodation provisions of the Americans with Disabilities Act and Title VII of the Civil Rights Act. These two laws generally require an employer to provide employees with a reasonable accommodation if their disability or sincerely held religious belief precludes them from getting vaccinated, so long as this accommodation does not pose an undue hardship on the employer's business operation. Again, this is true regardless of the Healthcare Right of Conscience Act. And put differently, employees with a sincerely held religious belief that prevents their vaccination can request an exemption from an employer vaccine mandate under Title VII currently and will still be able to do so under the proposed amendment. Indeed, the amendment itself specifically addresses this by stating that nothing in this section is intended to affect any right or remedy under federal law. In other words, even with the amendment, the religious accommodation exemption under federal law is still available for employees who have religious objections to vaccines if their employer mandates it, or also if they have any kind of physical medical condition. This amendment also only applies to COVID, not any other vaccine or any other healthcare service outside of the pandemic. Healthcare workers that object to participating in abortions or other objectionable services based on their conscience are still protected under this act in full. This bill that amends the act does not change the act in any way. I'd appreciate an aye vote, get this bill out of committee. So we can protect all the people in this state.
All right, thank you, Leader. We're going to go to the governor's office for some testimony. I believe it's Miller and Tiffany Newborn. If you'd like to proceed.
Yes, thank you, Chairman Rita, members of the Executive Committee. My name is Tiffany Newborn Johnson. I am the Legislative Director for the Governor's Office. I am here with Emily Miller, our Policy Director. I just want to keep it really short and sweet with respect to the intent of the amendment that's before you all today. Really, this amendment is a clarification of existing law. We are not seeking to make any changes to the original intent of the law. We are just seeking to clarify that the manner in which the Healthcare Right of Conscience Act is being used with respect to pandemic reasons was never intended when the act was originally created. We worked very closely with the Attorney General's office to come up with the language that you all see here now. And, with that, we hope that you would vote yes, and we're here for any questions.
Okay, here's how we're going to go. We have representatives from the Attorney General's office to do some testimony, and then we're going to go to Bob Gilligan, and then we'll go to some questions. Let's everybody get their testimony on, and then we'll go to some questions for each group if it pertained that way. So would the Attorney General's office would like to go? I believe it's what, Ashley Wright?
Good afternoon, Chairman Rita.
Oh.
Good afternoon, Chairman Rita and members of the committee. My name is Ashley Wright, and I am Chief of Legislative Affairs for the Attorney General's office. I just want to spend some time talking about the ramifications of not passing this bill and how severe they are. In terms of lawsuits, we've been seeing suits filed and expect to see an increase in the number of lawsuits against employers citing the Healthcare Right of Consciousness Act. In particular, today, you may have seen in Kankakee, a judge granted a temporary restraining order for the Riverside nurses citing the Healthcare Right of Consciousness Act. We've also seen downstate in Quincy, an Adams County judge also issued a TRO, a temporary restraining order against the Quincy physicians, surgeons, and blessing corporate services, citing the Healthcare Right of Consciousness Act. Many have asked us why we just don't wait for the courts to handle this. In our experience, we may be talking about 5 months plus. Getting rulings on executive orders from appellate courts has taken some time. They're generally not quick. And in that time, what we're talking about are really serious actions happening here. To be clear, if we leave Springfield doing nothing on this issue, we'll be walking back from all the progress that we've made so far. We'll be walking back from a state on all the mitigation efforts that we made, and that includes mask and testing. Not passing this bill ultimately means that the state cannot keep people safe, and we're talking about congregate settings here. We're talking about nursing homes and veteran homes. We're also talking about schools. What we're seeing as well is that there are being check the box forms being passed out to school personnel stating that they don't have to get vaccinated, and they're citing the Healthcare Right of Consciousness. What we're expecting after that is breakouts, school shutdowns, and kids and school personnel is getting sick and bringing that home to their families and caretakers. As Tiffany said, what we've done here is we're not proactively mandating anything. This is just clarifying what the law initially states. And again, we're happy to answer any questions. Thank you.
All right, next we're going to hear from Catholic Conference, of Illinois, Bob Gilligan.
Second page.
Bob, you might be muted, or if you're not ready, I could go to.
I'm good. Can you see?
Okay, good. Yeah, we can hear you now. All
Okay,
right.
sorry about that. Yeah, my name is Bob Gilligan. I'm with the Catholic Conference of Illinois. Here to oppose Senate Amendment 1169, Senate Amendment 2. First of all, before I make any comments, I would like to publicly thank the governor's office. We met with them a couple times, and I think we were able to get a better understanding of some of the complexities of this issue. And I hope they were able to understand our perspective as well. They were good conversations, and we're grateful that we were able to have a constructive dialogue with them. Our position is that we do not think the Illinois Healthcare Right of Conscience Act should be amended, especially in this 3-day session that we're looking at. We don't think there's ample amount of time for the public to weigh in on this very important matter. We're making progress. The number of those individuals who are vaccinated is rising. It's up. We see politicians like yourselves, community leaders, the many doctors and nurses that we see on TV, all advocating that people should be vaccinated. And, I'm proud to say that the Catholic Church is one of those entities. Pope Francis has said, and I'm sure you've read, that, being vaccinated is an act of love. It's an act of charity towards one's neighbor. I'm sure, Cardinal Supich publicly went to Mercy Hospital, I think it was, and was vaccinated. And all the bishops did the same thing. So we believe people should be vaccinated. But bills like this, they send the wrong message. I think it's important to remember that the enemy here is not ourselves. The enemy is COVID. The bill is sending the message to the public that conscience rights and religious freedom is not important. And we think it's important to retain conscience rights, especially during a pandemic. We're concerned that if you restrict conscience rights for COVID, well, what's next? Power given to the government is seldom returned. With that said, we understand due to our conversations with the governor about what's going on. We learned that in our talks with him. Our position is this, that there is no conscience right to refuse to be tested and masked. However, there is a conscience right to refuse a vaccination, and the policy of the state should be clarified as such. We should be able to scrutinize any conscience-based objection to testing for COVID. The tests are quick, they're non-evasive, and they do not appear to present any religious or moral conflict. There's nothing about the test itself or the purpose for which it's being administered that could even arguably violate a person's conscience. Now, let me just be specific about the wording in the bill. We have concerns with this language that allows for any measures or impose any requirements, including but not limited to any measure or requirements that involve provision of services by a physician or healthcare personnel intended to prevent contraction or transmission of COVID or any subsequent iteration. We think this language is way too broad. I think I read the word any 4 times. There's virtually no limit on what could be done in the name of addressing COVID with this language. So, like I said above, if a person claims a conscience objection to the COVID vaccine, there are other protective steps. They include masking, testing, and social distancing that the individuals will be morally required to undertake. This is how to best approach the current challenges that respect both the right of conscience and to protect other people. Thank you for listening.
All right, and I misspoke earlier. There was another witness, the ACLU, Amari Calafata, if I said that correctly.
Thank you, Amory Clefetta.
Okay, sorry about that.
And thank you for the opportunity to speak today. I am the director of the Women's and Reproductive Rights Project for the ACLU of Illinois. Although our organization takes no position on this amendment, we would like to offer context for the proposed amendment to the Healthcare Right of Conscience Act before this committee. To begin, we're seeing reports across the state of residents, including public employees, invoking the Healthcare Right of Conscience Act in order to avoid complying with vaccine mandates and other public health measures intended to curb the spread of COVID-19. Despite the hyperbolic use of terms like freedom and liberty, mandates designed to curb a public health crisis like a pandemic are consistent with civil liberties and need not include an exemption for religious objections. But more to the point, this attempted use of the Healthcare Right of Conscience Act runs far afield from what the law was originally intended to do and the public policy objective it was intended to serve. The Healthcare Right of Conscience Act was never intended to be used the way it is now being invoked. The original form of the law was passed in 1977 as part of a wave of states across the country enacting similar laws in the wake of the Roe versus Wade decision. What it was meant to do was to allow for conscience objections from healthcare professionals who object to providing a certain service to patients because of a religious or conscience-based belief. The law is intended to prevent healthcare professionals or institutions from being sued or facing other legal consequences. The typical example where we would expect to see it invoked is a doctor who does not want to perform an abortion or provide birth control. The people it is intended to protect are people who are directly providing healthcare services to patients. The law is not meant to be a personal shield against a vaccine mandate. The Healthcare Right of Conscience Act has been on the books in some form for decades. Until now, I'm not aware of any instances where the law has been used by employees trying to avoid vaccine or testing mandates. And until now, no court has approved such an exemption citing this law. The Healthcare Right of Conscience Act has long raised concerns about the nature of the broad protections for healthcare providers and institutions that may result in harm and denial of care to patients. For example, prior to a 2017 amendment to the law, doctors, nurses, and hospitals could refuse to provide care and even information to their patients if they object to doing so on religious grounds. Patients experienced real harm as a direct result of this. It is imperative to guard against the Healthcare Right of Conscience Act being invoked in a way that is contrary to its clear purpose and in a way that exposes other people to harm. Thank you.
All right, thank you. You there? Laughing here, we got echoing and multiple speakers going. Oh, I'm sorry about that. Can you guys hear us? Okay. All right, so we have another, I believe, on the link that we provided, Representative Wheeler, I believe you mentioned a firefighter, Frank Fee. Can you hear us, Frank? For oral testimony. I don't know if he's joined or not, and then you believe there was another group that you said, Keith, was one more police.
No, they haven't responded to requests from staff yet in communication we've had. So I think if Mr. Fee wants to testify, that'd be great. And I appreciate the opportunity for him to hear what he has to say.
Okay, so we don't know if he's on or not. We did send him the link. It don't appear he is on. If he comes on, we'll let him do a little testimony. In the meantime, if that other group that you've reached out to or that reached out to you that said they wanted to do oral testimony, we'll allow that to go through. In the meantime, we're going to go to questions. And if we'd like to start with Representative Leader Brady or I don't know if he's set up and ready. Is that good?
Can you hear me all right?
Yes, if you'd like to go to your questions.
Thank you. Thank you very much. I'll be brief. To the bill sponsor, first off, Representative, you had indicated through some of your comments that through Title VII and other aspects of state and federal law, there's really nothing that's being changed here in this proposal. Did I understand that correctly?
I would say that according to federal law, both the religious right of conscience and the physical or medical reason are two reasons that someone could request an exemption from the vaccine.
Okay, and so there have been overriding comments that we're really not changing, we're codifying law. And I believe that the Assistant Attorney General testifying indicated that we're not seeking to make any changes. They're trying to reduce down lawsuits that have been filed. So if I'm correct, and out of fairness, certainly if the Assistant Attorney General wants to respond to that, please do so if I summarized her comments correctly.
We're just pointing out that the Healthcare Right of Conscience Act can't be used in these cases, that it can be, the federal law has to be used.
So I guess that's what I'm trying to drill down to, is that while it sounded like, we weren't changing things under the act and whatever the legislative intent was back in 1977 when this bill was changed, we are in fact making changes to this legislation. And that's what 48,000 some people are concerned over, that have sent their voices to us in Springfield via trying to respond to what they believe is going on in the legislation. So I'm just looking for clarification. Testimony has been that we're not changing anything, but in fact, we are changing things. And so that's in fact where the questions lie, at least that I have, and apparently many others have.
Well, I will say again that we are not changing anything in the Healthcare Right of Conscience Act. We are simply saying that it cannot be used in these cases around COVID. But perhaps the Attorney General's office wants to clarify that.
So just, you are changing in the act because you're changing it around COVID.
We're just saying that it can't be used for COVID. There's nothing in it that says it can be used for COVID, so we're just saying it can't be.
Right, but you're making a change. That's what I'm getting down to. It sounded as if in earlier testimony, all you're doing is codifying law. You're not making any changes, not seeking to make any changes. That was a quote.
The intention of the law was always around reproductive rights.
Okay, so the law intends to make changes, and that's what has people very concerned. Thank you.
Representative Brady, did you want a clarification from the Attorney General's office?
Sure, if you'd like to make a follow-up comment, sure.
Hi, Leader Brady. So it is a clarification of what the original intent of the law is. In fact, we explicitly stated, this section is a declaration of existing law and shall not be construed as a new enactment. So hopefully that clarifies exactly the fact that this is intended to be a clarification and not something new.
Well, I think we're somewhat splitting hairs here, that we are making changes, call it a clarification, codifying, call it what you want. To your average citizen out there, you're making a change in the legislation. And that's, in fact, in my belief anyway, what's causing, and in my belief, understandably so, great concern over the legislation. Thank you.
All right, thank you. That concludes your questions, Representative Brady?
Yes, thank you very much, Chairman.
All right, we have a Shannon Addock from Awake, Illinois, for some very brief testimony. She was one of the ones, I believe, Representative Wheeler did.
Hello, are you able to hear me?
Yes.
Thank you so much. I, for the record, did, as our organization, apply to do oral and written testimony. However, I was not given any instructions on the follow-up. So thank you for this opportunity. I would like to read the statement that I did submit to the Executive Committee today on behalf of our thousands of Illinois members, concerned citizens, and so I will read that now. Dear sirs and madams of the Executive Committee, as this Senate Bill 1169 House Floor Amendment 2 is put forth to your committee, our organization requests a halt to said filing pertaining to the Healthcare Right of Conscience Act. Over the course of the past year, numerous Illinoisans have been fighting very hard against various forms of government overreach in an effort to preserve the integrity of our state and federal constitutional protections. This is an opportunity for you as legislators to stand in solidarity with a stressed and concerned constituency. Our organization has supported many citizens over the past many months by empowering them to know their rights, especially the ones found in the Healthcare Right of Conscience Act. This amendment was filed yesterday by State Rep. Mary Gable and is being fast-tracked given the schedule change from Thursday to today. Her staff has been responding to constituent concerns with the following statement today. Quote, the HCRCA is there to protect healthcare professionals from performing acts against their religion. For example, if a Catholic doctor wanted to refuse to perform an abortion, the HCRCA protects them. As that was the original intent of the law, the current amendment is designed to protect that right and limit it to its intent, end quote. This response is in conflict with the proposed amendment. The filing aims to alter the act for the specific purposes of COVID-19 healthcare decisions, rather than attempt to preserve religious objection to abortion procedures. For transparency, it's worth noting one of Rep. Gable's prominent campaign endorsements is from Planned Parenthood, a prominent abortion provider. If Rep. Gable supports the choice of Illinoisans, amending this act would in fact restrict citizens' choices pertaining to their will and conscience, namely over COVID-19 healthcare decisions. Therefore, in order to dutifully support choices for all Illinoisans, this amendment ought not to be brought to vote. As elected legislators in the land of Lincoln, we appeal to your leadership in supporting the rights and constitutional protections of Illinoisans. We hope and pray that you will not enslave the will and conscience of Illinois citizens with this amendment. As of this morning, there were 33,910 witness slips, and as you've shown tonight, there are far more that were submitted in opposition to this amendment, versus at that time this morning, 465 proponent slips. On behalf of the Illinois citizenry, we implore you to dutifully oppose any amendment to this act. Awake Illinois always welcomes open dialogue, should it assist with bridging any gap between you and the constituency. One last remark, I was taking notes when Rep. Gable spoke, and she said this wouldn't affect children. On the contrary, the changes would apply to children because in line 3, it does mention excluding individuals from a school, which would obviously pertain to children. Thank you for the opportunity to speak.
All right, thank you, Shannon. We believe Frank Freeze, if I'm saying that correctly, is signed on successfully here. So we're going to get a brief testimony from Frank.
Nope, not a word about children.
Hi, how are you? Can everybody hear me okay?
Yes.
Thank you for your time and consideration. I really appreciate you guys taking the time to hear us out. I represent a large member of the Chicago firefighters. Some of our concerns we would just kind of like to share with you. We kind of feel like we haven't had a good communication. A lot of information has not been shared with us. So we're kind of in a position where we have a lot of firefighters who have fought faithfully through this pandemic, and we were asked to work under very adverse circumstances where people were getting sick and firehouses were getting contaminated. We are in a position now where our brothers and sisters are under such stress because we have no information. We're being told by our union and everybody that we're trying to talk to that nobody will sit down and explain things to us. Is there a way that we could get a better correspondence with whoever we need to speak to on the political side, lawyer side, the city side? We are feeling like we are being left out. People at work are being put in adverse, stressful situations right now. It is hard. I'm talking to other employees. It's very hard for them to concentrate. So I'm just trying to give you a picture of what it looks like at the firehouse. People are in extreme fear of losing their jobs. Some of us have severe beliefs in religious exemptions, and different issues with this vaccine that are not being heard. We want to just be able to have a place at the table to sit down and be heard. We are working, a lot of our brothers and sisters are working in fear. And not you, and I'm not blaming anybody, but because of the lack of communication, we are not able to concentrate on our jobs, on our tasks. We are trying to take care of each other, and it is a severe issue that needs to be addressed. Somebody needs to please sit down with us and give us better guidance, better understanding of what is going on. Because when we go to our union, they're telling us that the city won't sit down with them. And there's very little information that we know. Everybody is living in fear because people are being taken and put on no paid status. And we're all being told that we're going to be fired on January 1st, but we're not given correct guidance. We have worked faithfully through this pandemic. When other people were told to stay home, we went out and we fought and we did everything we could for this city and this state. And we proudly and faithfully serve you. All we want is for someone to please sit down with us and give us better explanations and for us to be able to save some time and understand things better. I thank you guys for everything you're doing, and I thank you for this time. God bless you all, and thank you.
All right, thank you, Frank, for your testimony. And all right, we're going to go back to questions. We're going to go to Representative Wheeler for a few questions.
Thank you, Mr. Chairman, and first let me say thank you to Mr. Fee and all his brothers at the fire and sisters at the firehouses who have been working hard over this last many months now, looking out for those of us. And so I say thanks to all everybody in the public sector who has stepped up like that. Let me start with a kind of a follow-up to what Mr. Gilligan had brought up. Representative Gable, if you could just walk us through, I'm looking at the language of this bill, and it's very broad in one particular section here, saying that any person or public official for any public or private association, corporation, entity, institution, or employer to take any measures or impose any requirements, including but not limited to any measures or requirements that involve provision of services by a physician or healthcare personnel intended to prevent contraction or transmission of COVID-19 or any subsequent pathogens. Robin, if you could explain why it's so broad. This seems like it's way overbroad, and I think Mr. Gilligan has a point there.
Yeah. Well, I'm going to say a few words, and then perhaps Tiffany Newburn or Ashley would like to follow up. But I think the key words there are intended to prevent contraction or transmission of COVID-19. So the purpose of this is to prevent contraction or transmission of COVID-19 or any other pathogens, which means any other variants. And I think that, we're only aware of some now, but if new prevention techniques or kinds of services occur, then we want to make sure that those can be implemented as well. We're operating in the middle of a worldwide pandemic. We've lost 700,000 people in this country already. And I think we have to do whatever we can to prevent the contraction and transmission of this disease. But I'll let Tiffany or Ashley say more.
Thank you. Do you want to add to it?
Sure. I would just echo what Representative Gable said, which is that the relevant part of the section that you just read is limiting this to COVID-19. I would also point to the remainder of the existing act, which is, I agree with you, very broad and not very well written, and it includes many of the items that you just read off. So to the extent that it mirrors existing language, I agree with you that that sounds broad and not very well written.
Well, I guess I
That
look
is
at the
why we are
amendment as,
clarifying in this language, which again is a declaration of existing law, not creating anything new, no new standards. So thank you for the chance.
well, I guess that's, let me just go down that avenue with you guys, because you're saying it's not creating any new standards. You're right. There are no standards in this. It's any for anything. Anybody can do anything they want to, according to this. And there are no standards. I serve on JCAR, which we look at very closely at what thresholds are actually something you can do in compliance with the current rule or statute. Who decides when or when not something is intended to prevent contraction or transmission of COVID-19? There's way too many different opinions. I'm not talking about, on social media. I'm talking about among the people in this building about what we should be doing with respect to COVID-19, and to leave it so wide open, in my judgment, is too wide open. I just don't see how anyone can really define what the parameters, what are the lanes that this is guidance for. This is actually way too much latitude. Robin, if you could address that, I'd appreciate it.
It does, the sentence before that, any measures or requirements that involve the provision of services by a provision or healthcare personnel. So these would be services by a physician or healthcare personnel. It would not be some of these other means that other politicians have decided would help with COVID.
It says, but not limited to, right before there. So that negates everything you're saying. It's not limited to that. That points at that, but it's not limited to that.
I'm not sure where the any limited fits in.
Keith, you're muted.
Thank you, Mr. Chairman. I don't see how we've vetted this enough to even consider a vote on this. I mean, I have real concerns about this approach, and I'd like to hear from others who want to ask questions. And Mr. Chairman, if you could call me later, I'd be grateful. Thank you.
All right, thank you. I have a question. This may be to the governor's office. Who does this amendment impact?
Thank you, Representative. So there are quite a few businesses, local school districts, universities, hospitals, childcare centers who have already imposed, their own COVID mitigation measures. This law actually would impact them and ensure that those individuals who have imposed their own protective measures would, be protected under this act. There is the possibility that, without this clarification, that those businesses, including some major corporations, would be subject to additional lawsuits, which I think were, we kind of addressed early on. But they've taken the initiative to take those additional work safety steps. And we want to make sure that those decisions by the individual corporations, school districts, childcare centers, including some of our state facilities, are protected.
Okay, thank you. We're going to go to Representative Mazzacci for some questions.
Thank you, Chairman Rita. Just to start off, and this is a question for the governor's office, historically, to the extent we have had any vaccination mandates, not only have they been enacted into law by the General Assembly, but the ones that I'm looking at, certainly the ones that are cited in JCAR, such as 105 ILCS 5, section 27-8.1, 20 ILCS 2310-650, 40 ILCS 315-2, every single one of those has been a vaccine mandate that's been put into law. Every single one of those also has a clear exemption for religious objections. And even some of them in the implementing regulations have additional protections in not only for religious reasons, but also allows people to be able to show proof of immunity, not vaccination, but just proof of immunity, i.e. proof that you had the disease, as a way to comply with the statutory requirements. Here, the governor seems to be operating by executive order through IDPH. Why is it that you simply, if the governor is worried about the ability to have schools or hospitals or et cetera, force COVID-19 vaccinations, why are you simply not going that route where we make it abundantly clear that this has to be done through statute? It's a statutory mandate. We put in the usual customary religious and proof of immunity exemptions that we have in other statutes, and then go from there. Why are you trying to do it through the back door with the Healthcare Right of Conscience Act?
I want to just stress one, that this is, to be clear, this is not a mandate, this is a clarification again. And this clarification would not interfere with any sort of religious exemption or federal law that is currently in place. I just want to make sure that I understand your question. Are you asking why we're not going the mandate route instead?
Well, here's the way in which I look at it. Representative Gable, or Leader Gable, has said that the whole purpose of this is to ensure that people are not raising religious exemptions in connection with, state of Illinois law religious exemptions in connection with COVID-19 related issues. And frankly, I think that the statutory language that's here goes above and beyond that. I mean, right, let me put it this way. Right now, can you point to anything that we have in state law that mandates that police and firemen have to take any vaccines as a condition of employment?
But I mean, I would have to go back and, double check.
Well, I haven't found any. So, you're saying, for example, that you think you need this in order to make sure that, police and fire are getting COVID vaccinations or, not going to be spreading or transmitting COVID. But, we've known about flu vaccines, we've known about pneumonia. There's a whole host of communicable diseases that could, potentially be spread by police and fire, and yet we apparently haven't seen fit to enact that into a statute. So what is it exactly that you need here when it comes to doing what it is you think you need to do to protect public health?
Right. So I guess I don't want to get distracted from the main point here. We just want to make sure, because this is real, people are using the Healthcare Right of Conscience Act as a reason not to get vaccinated.
Right. And but the whole point is that every time before, when there's been coercion to compel vaccinations, we have always in the state of Illinois, we say we want everybody to do it, but we've always given people an out with religious exemptions. And, for certain other things, you're allowed to show proof of immunity. So it doesn't, why does it surprise you that when the legislature hasn't specifically put into place a COVID vaccine mandate, that people aren't turning to the more general Healthcare Right of Conscience Act? That's the whole purpose of it. You haven't done the work to get a specific vaccine mandate enacted into law by this General Assembly. So where historically, every other time, we've always, in state law, not just kicking it to the feds, under state law, have given clear religious and other rights of conscience exemptions. So now, we don't have a clear statutory mandate to vaccinate for COVID-19. Why is it surprising that people are saying, well, I don't have the statutory right, therefore, this wasn't something that the legislature put into by law to statute, where normally, as part of the give and take of the legislative process, these sorts of things are adopted as a matter of course. Now that extra statutory means are being used to you think it's a good idea they take a vaccine or not. Now you're saying, oh, well, we're upset that people are trying to invoke their right of conscience. We've always let people invoke their right of conscience, particularly when it involves religious freedom exemptions.
Right. So
at the state level.
So this does not stop people from, it does not stop the religious exemption.
How is it not the way in which you've got this crafted?
It doesn't. We cannot affect federal religious exemption. We cannot affect
state law. State law. We have, look, if you don't want to get immunized for hepatitis B, you don't want to get immunized for measles, mumps, rubella to go to school, you're allowed a religious exemption currently. True or false?
True. However, this act.
Okay. So now, why are you? So now you agree. We don't have any state law that's been enacted that is forcing parents, as a condition of going to school, your kid has to get a COVID vaccine or fall within the scope of a religious exemption. True? It's true. So why are you so eager to jettison existing? I mean, if for every other vaccine, which also involves nasty communicable diseases, we've always allowed for religious exemption, why are you saying COVID now somehow is treated differently? I mean,
Representative, that is not what we've said. I've said repeatedly that religious exemptions are continued to be allot both religious.
Where? Robin, Leader Gable,
in the last line,
not state law religious exemptions. So we have always had independent state law religious exemptions, always, for all of our vaccine mandates.
In the last line, it says nothing in this section is intended to affect any right or remedy under federal law.
Federal law, but
the state allowance of the religious mandate is the same exact language as the federal law. So we are not changing anything about religious exemption. That will still be allowed, as well as medical or health exemptions.
That is completely not true.
You can keep saying it as much as you want.
It doesn't matter. You can have a federal remedy and you can have a state remedy. And the state remedy, the fact that we have enacted it into statute, gives independent legal defenses to whatever it is government wants to do. But the fact that you are now saying we're only going to permit what's recognized by federal law, and we are going to allow nothing at state law, that's the whole point. You're saying that all of our existing religious exemptions that exist at state law, they're a nullity if you go through this. And the other thing too, by the way, this is not just limited to vaccinations. This can be read incredibly broadly. If an employer says, you know what, I know that you're a member of the Jehovah's Witness faith, but I think that if we require you to get a blood plasma infusion of COVID-19, that's going to make it easier and it's going to make it harder for COVID to be transmitted. You're basically saying that employee can be fired for refusing to accept a preferred treatment that their employer wants them to have. If I'm a landlord and I say, I don't want anybody living in my building if they're not vaccinated, I have the right to kick them out. And you basically said that people in response would not be able to raise this as the violation of their healthcare right of conscience as an affirmative defense to that, or as an independent claim.
So Representative, my understanding is that if we have a state law which says that you need to get a requirement, like schools, we do say in there that you can have a religious exemption.
Right.
So what we are saying in this amendment, this addition to the Healthcare Right of Conscience Act, is that that for employers, you cannot invoke the Healthcare Right of Conscience Act. That doesn't mean that you can't invoke federal laws, particularly for the exemption for religious exemption.
Okay.
So
maybe we can get at it this way. Right now, if I am an employer and I were to say to all of my employees, I'm going to mandate that all of you get the hepatitis B and the flu vaccines, you would not have the right as an employer to forcibly do that. And an employee could then say, no, I'm invoking my rights under the Healthcare Right of Conscience Act, which allows me to refuse to obtain any healthcare services or medical act. That's in our findings. That's in the findings.
Interestingly, I don't believe it's ever been used before. This is
because we've never had a situation where we're coercing medical treatment outside.
We've never had a situation where we have a worldwide pandemic. We've never had a worldwide pandemic before.
Well, but this gets back to my original point. Then why is the governor not coming forward with specific language that says, here is COVID-19 vaccines. We are going to force a COVID-19 vaccine mandate. Or we are going to force you to engage in plasma treatment. Or we are going to coerce the use of masks. There's all, I mean, and by the way, it doesn't even have to go there. Employers could come up with a whole host of crazy things that they could put on their list of things that they think that needs to be done to prevent COVID transmission. Maybe they're going to say, you know what, we think we need to fire all of our older employees because the people over the age of 65 are the ones most likely to actually get COVID and transmit it to others. And therefore, we're going to engage in a little bit of age discrimination we'd never be able to engage in otherwise, so that we in turn can get rid of all of our older employees. If you are if as long as an employer says no, not because of just your age, it's because because our efforts are intended to prevent contraction or transmission of COVID-19 in our workspace, then they're allowed to do it under this, because you've now said that that it's not a violation of this act to do something like that. Normally, if children were going to be denied access to our public schools, you would have to go through a whole due process hearing and come up with a whole host of, statutory reasons why students need to get kicked out. Here, you could have any, low-level public official, doesn't have to be anybody from the Illinois State Board of Education. It could just be a school nurse who says, you know what? I think that child over there, maybe that person even has a personal animus. I think that child is not doing something that I think is going to be compliant with COVID requirements. Therefore, I think they need to be removed from school. And you've got no cause of action in response, because it's not a violation of this act to enforce any measures of requirements, including excluding individuals from a school in response to non-compliance for anything, not just vaccination, not even masks. It could even be that a child, that a child and their parents refuse. Maybe you've got somebody from downstate who's a school nurse who says, you know what, your kid just tested positive for COVID. I want them to take ivermectin because I think that's going to be the best way to prevent transmission. And a parent says, hell no, I don't want my kid to take ivermectin because I think that's a quack medical theory and I don't want it used. Under the way in which this language is drafted, the school nurse could kick that kid out because that kid has not complied with any request by a public official or for any employee of a public agency that is intended to prevent contraction or transmission of COVID-19. You could you could have employers saying, well, we know that obesity is a significant risk factor for COVID-19. So if everybody in our, who's over a certain BMI doesn't lose weight, well, then we're going to tell you that you're fired because the actions that you're engaging in by not losing weight, that's not going to allow us to achieve our goals to prevent contraction or transmission of COVID-19 at the workplace. This language is drafted so broad with no limiting principles at all, and it is, no reasonableness standard, no requirement of, what you're proposing is efficacious or anything.
Representative.
Crazy.
Representative Mazzacci.
Yeah.
Do you have another question?
I do have another question.
All right, let's limit this down to some questions about the legislation so that you could get the answers that you would either want on the record or that you would like to have a clarification on, because we do have other members that would like to ask some questions, and unless you'd like me to go to them first. And
Well, here's
Gather
the
your
critical
questions
question.
together.
Explain to me why this is not going to have a disparate impact on the African-American community.
you asked
Because
me
because
or
the
you asked
African-American community in
Representative
Illinois
Gable.
is historically under-vaccinated. Tell me why implementing this is not going to make it harder and easier to deny African-Americans access to public institutions, including our schools, public transportation, as well as private employment. You're on mute.
Ashley, would you, well, is she still on here? Ashley, would you please answer this question?
They're all gone.
Sorry, I was looking for my mute button. Certainly. You know, again, this does not mandate vaccinations. There's nothing here that proactively mandates anyone to do anything. So one of the reasons why this would not disproportionately affect African Americans is because African Americans would still be able to avail themselves of the other options that their employers would put out there. So this does not target one specific race or any other specific population within Illinois.
Well, what if an employer says, I don't want to have to go through testing, vaccination or nothing? How is that not going to have a disparate impact?
Representative, I'm sorry, do you mind repeating that?
Yeah, if I'm an employer and I don't want to have to pay for people to get tested every week, I say that as a condition of continuing employment, it's vaccination or you're fired. Tell me why that's not going to have a disparate impact.
Representative, that doesn't change under this bill. An employer could currently require vaccinations as we've seen here. This bill does not change that. What this bill changes, or what this bill does is clarify what is available to bring within court. That does not change the ability of an employer to put out some type of mandate for testing. That is currently available to employers. Employers have been doing that for quite some time now.
No, but they say no religious exemptions. No exemptions, no anything. Ditto for public schools. Public school says we're going to mandate every person who wants to, walk into this particular public school. The students have to be vaccinated or they're kicked out or they've got remote learning. Why is that not going to have an adverse, disproportionate effect on African Americans?
All right.
Representative, again, mandates have been going on. This bill just clarifies what the intent of the original bill was.
Well, no, it doesn't. It's taking, okay, so here's another thing. You would agree that under the current Healthcare Right of Conscience Act, that anybody has the right to refuse to obtain or receive medical services, including diagnostic tests, right?
Representative, I agree that the language is quite broad and that it goes against the original intent of the bill.
It's irrelevant what the original intent of the bill was, because if the statutory language is clear, and I know this is why I've complained about Democratic bills on the floor all the time, is because it's irrelevant what your intent was. What matters is what the language of the statute says. Now, under Section 7 of 745 ILCS 70/7, true, it says discrimination by employers or institutions. It shall be unlawful for any public or private employer, entity, agency, institution, etc., to place any reference in an application in connection with hiring, or to otherwise, on account of the applicant's refusal to receive, obtain, accept, perform healthcare services, they've got a cause of action under the Illinois Healthcare Right of Conscience Act, right? For any medical treatment. Doesn't have to be, I object because it's a religious reason.
Representative, I disagree.
It could be anything relating to my conscience, which could be a whole host of things.
Representative, I disagree that the intent here does not matter. I believe that the intent shapes the entire reading of the bill, and that's why we are bringing forth this amendment to clarify. how the bill should be read.
Well, if you think the legislative intent is so clear, why do you need this bill? Because if the legislative intent was so clear, then it should be in the prior legislative history, and you can simply use that if you go to court. That's the whole point, right? The problem is, you know full well that that prior legislative intent is not so clear as to what the purpose of the bill was, and you're trying to reshape and reform the scope of the bundle of rights that people currently have in the state of Illinois. Let me ask you this. Section 8 is titled Denial of Aid or Benefits. So what's going to happen when you get somebody in some county somewhere who says, you know what, you're not vaccinated. We've got you know, budget constraints. So we're only going to give our SNAP benefits, or we're only going to make sure that TANF benefits, or we're going to say that, you know, some of our local township senior services, those are only going to go to people who have been vaccinated. Right now, under 745 ILCS 7-8, you as a person would have the right to go sue. And now you're saying that, nope, as long as the reason the township or state agency gives for why they're denying you benefits is because COVID, then that becomes okay.
Representative, I disagree. The bill is very limited to the attempts to prevent the transmission of COVID. So I don't think that applies here.
Why wouldn't it? What if they say, you know what, nobody can come in person and apply for benefits because that's
here's what we're going to do. I think we got we're going to agree to disagree on the intent of the legislation. I think you got your points across, Representative Mazzocchi. If there's any other specific questions pertaining to something that has not been addressed or talked about, I'd like you to move on to that portion. Otherwise, Representative Davis Meyer has had his hand up for a long time. I'd like to give him the option of asking a few questions. So
all right, sure. One more question for the Attorney General's office.
We're being redundant in what we're doing, and I don't believe that is productive at this point.
One more question, if I may, Chairman. For when it comes to jurors, are local court systems going to be allowed to say that if you are not vaccinated, we're not going to let you be eligible to sit in our jury pool?
Again, Representative, COVID mitigations done by states, counties, and employers have been in place this entire time. This amendment does not change that.
Right, and if someone says that the reason why I am not vaccinated is because I believe that doing so would violate my rights of conscience, or because I already have immunity, they're going to be denied, for example, from sitting on a jury pool. That's going to be grounds to exclude them.
Okay, is there any other questions? We're going to move on to Representative Davis Meyer for some questions.
Thank you, Mr. Chairman. First, I'd like to ask, what's the House rule or on the House campus as far as wearing masks?
Is that a question to me?
Yes, sir.
Okay, can you repeat it? What's the rule on wearing masks on the House floor, or on the campus, or
on the campus?
I have no idea right now. I think there's a mandate of wearing it, right?
Yeah, I'm just saying you're sitting pretty close to somebody, and I believe there's a mask mandate that you guys are both ignoring, which is frustrating. It just shows the perception behind some of this. So I'll move on. When we're talking about this being clarifying legislation, right? We're talking about this being clarifying legislation. You're not writing a new law. You're not expanding it. You're saying you're clarifying it. When will you be clarifying it for the flu? Representative Gable, Leader Gable, you've had a bill to require kids to get the HPV vaccination. What about hepatitis or AIDS? What other vaccinations will we be later requiring or not allowing a conscientious objection to?
Muted.
Yeah. Well, there are many vaccinations that are required for school children. This law, it does not address those vaccinations for school children. All it's addressing is COVID-19 during a worldwide pandemic.
So will you be able to come back and clarify that this also requires people to take the flu shot?
No.
No, you will not?
No.
Why can you only clarify that it applies to COVID?
That this bill clarifies COVID.
Why can you not later come back with a clarification?
We can do any bills we want in the future. We can have many different kinds of bills.
So are you changing the law or are you clarifying?
That's not what I'm bringing to the General Assembly today. Today, I'm bringing a bill to you that provides an additional piece to the Healthcare Right of Conscience Act that states that it does not apply for COVID-19.
So today, for your purposes today, you are quote unquote clarifying that this only applies to COVID. But next week you come back and clarify, quote unquote, that this also applies to the HPV vaccine. Could you not?
I'm not going to say what could be done in the future. Today, we're talking about this bill.
You are using this narrow scope, which I would say changes the law, not clarifies the law, to go after COVID because people are scared. You are using people's fears to try to force people to do something that they are concerned about for their own health care. For their own health care, they are concerned. I am so tired of people saying anti-vaxxers. Do you know how many people I've had in my office that every year get the flu vaccine? Every single year get the flu vaccine. But they're concerned about a vaccine that came about, less than a year ago? Has not been approved by the FDA.
It has been now.
No.
It has been now.
What has?
The vaccine has been approved by the FDA. Pfizer.
Okay, Pfizer has. So they can require Pfizer, but they can't require. Pfizer has been approved. Can they allow Moderna or J&J?
I think they have. Yes.
So it's a person's choice. I don't understand at what point this ends. At what point does the government stop telling people what's best for them?
Yes. Well, I think
without them being able to take their health care into their own hands, right? I think that if I go into the doctor and they tell me today that I have cancer and I choose not to do chemotherapy, I have a right to not do that.
That doesn't affect all these other people around you. That's not a communicable disease. We are doing this to address a communicable disease that has worldwide impact, that has killed
let's talk about the flu.
5 million people worldwide.
Let's talk about the flu. I have a coworker whose daughter almost died from the flu. Do you want to require the flu vaccine?
It is not at the same numbers that we're talking about with COVID.
Look at the history of the flu.
You consider flu being a worldwide pandemic?
It was at one point.
No, but it's not now. This is a very specific bill to address a very specific problem that is a public health emergency that we are trying to address.
How many years of research do we have on this COVID vaccine?
It just came up. I don't know. Many people I know are grateful to have this vaccine.
And so because those individuals are grateful, that allows you to force people to not be able to make a healthcare decision.
Nobody's forcing anybody.
You're allowing this because you want the governor to be able to mandate this stuff without the General Assembly being involved, by the way.
No.
Right? No. We have not been involved up to this point. We have not had a discussion about COVID. So now you're trying to pass this and pretend like it's not about COVID, even though It's clarifying specifically for COVID so that the governor can mandate this on people.
No.
Correct?
No.
Well, that's not why.
No.
So then why do you need to do this?
I have
if
said
it's
this
not
many-
because of the governor's mandates.
This is to help employers, the relationship between employers and employees.
Gotcha. So we're making sure that we protect corporations over individuals.
We are making sure that we are protecting the health of the people.
Nope. You were talking about, and earlier, Tiffany from the governor's office stated that we're concerned about the liability of businesses. We're concerned about the liabilities of daycares. We're concerned about the liability. They didn't once say anything about the concern for the health care of the individuals. Not once.
Well,
so
is.
to be out there and pretend this is about power, this is about forcing people to do something they don't want to do. And by the way, I specifically asked the governor's people, right? Because the governor doesn't really talk to very many people. So I specifically asked, I said, look, if you get rid of the mandates, I will help encourage people to get the vaccine. People are tired of mandates. They are so tired of mandates that they've dug their heels in, and now you're going to force them. You're going to force them under penalty of law or losing their livelihoods. You're going to make them lose their livelihoods. You're going to kick them out of their jobs because some people feel more comfortable with the vaccine.
Different employers have different rules, but I have to tell you that this is really to protect our students in our schools. It's to protect our people in our nursing homes. It's to protect veterans in veterans' homes, people in healthcare facilities. Those are the employers that where this has been an issue.
So you're going to force state employees to get it. You're going to force teachers to get it. You're going to force daycare workers to get it. Eventually, you're going to force kids in schools to get it. Where does this stop? It is about an individual's ability to make a healthcare decision. You know what?
So this isn't just about vaccines, Representative. It's also about masking. It's about testing.
Which you're not wearing right now, right next to somebody.
Actually, it's not required. It's required in the chamber and in the hallways. It's not required in a room. There's only two of us. He's sitting here. So it's not around hundreds of people as we have in the chamber.
So it's okay if you're supposed to social distance. And I believe when I walked into the door of the Stratton building this morning, there's a mask that requires you to wear or a sign that requires you to wear a mask. This is, you are forcing people to do something against their will, forcing them to take a vaccine against their will because it makes some people feel more comfortable. Right? No. This is their life.
This is an employer's ability to protect their workers and their people who, their customers and the people that they serve.
By forcing a healthcare decision
and
not allowing them to make an honest, concerned decision for themselves, for their own healthcare. So if there are adverse outcomes to this, who is liable now? Is the state of Illinois liable now? If a business decides to mandate something, who is liable?
Maybe the AG's office can help me here, or the governor's office.
Yeah,
somebody has to be liable.
For what? What are they liable for?
Again, this is
first reactions to the vaccine that was required by law, required by individuals, by businesses.
Okay.
Go ahead.
About clarifying the existing law. This is not about liability. This is about, as Leader Gable had indicated, this is about protecting the individual's within the corporations, within the childcare facilities, within the schools, within the healthcare facilities. It is about protecting those individuals who want to ensure that there are workplace safety measures in place.
Tiffany, you specifically said earlier that you were worried about business liability. So who takes over that liability if a business requires this? Now the state is allowing them to require this without an individual's personal health care decision. Who takes on the liability? Somebody has to take on the liability. So is it on the individual who was forced to take it?
Yeah.
And go ahead. I think you're on mute still.
If I can help here a little bit. So I believe what Tiffany was referring to earlier today is the way the law actually works is that an employee can sue an employer for not following the law. And there are financial repercussions for losing the lawsuit for an employer. So what we've done here is try and work to protect not only citizens, but employers by not allowing this one particular act to be used in a lawsuit. Again, other acts they're able to avail themselves of other acts of other federal laws, but this particular act would not be allowed. So that's the clarification that we've made here. We've not mandated anything. There is no mandatory vaccine in here. There's no mandatory masking, no mandatory testing. That does not exist here in this language.
The mandates are on the outside directly from the governor through executive order. So this is the gutless General Assembly sitting on the sidelines saying, Governor, we got your back, but we don't really want to make a real decision on COVID. We want to let you, we want to take away the individual healthcare rights of the individual, and that will allow you to mandate this. That's what it sounds like to me. We're dealing with individual healthcare decisions, and the state of Illinois is going to allow an outside individual, an outside entity to force this upon other people. Correct?
Representative, as I stated to Representative Mazzocchi, mandates from an employer have already been in place here. This does not change that. This simply clarifies what the intent of the Healthcare Right of Consciousness Act was meant to be.
So where is that clarification coming from? How do you know that when they wrote this law that they wanted COVID exempt from this law if COVID didn't exist when this law came through?
Representative, what we know from the legislative history is what they intended for the law to actually cover. And what that was intended to actually cover was individuals who did not want to provide abortion care and giving them the ability to opt out of that without facing repercussions from their employer. And if their employer did provide those repercussions, then they could file suit. So that was the entire legislative history. There was no mention of any other diseases. Obviously, COVID-19 is new, but other diseases have existed. And at that time, that discussion was not there in the legislative history.
So why do you have to specify COVID? Why don't you just leave it open? Because then it would cover the flu, HPV, whatever a company wants to require of their employees, they can require, right? Without any conscientious objection. Correct? We're saying the original intent, and it was discussed earlier that the original intent of the law is whatever the law says, right? The interpretation is up to a court. So why would, even if this passes, would an employee still be able to sue a business?
Yes, an employee can always sue a business. What we're saying here is that the Healthcare Right of Consciousness Act does not apply in this situation. As stated earlier, if an employee has a religious objection, that can apply. If there's a Title VII objection, that can apply. There are all types of other objections and reasons for suing an employer that are not covered under the Healthcare Right of Consciousness Act. What we are stating here is that the original intent of the legislature did not intend to apply to COVID-19 mitigations. And so we are just clarifying that fact.
You cannot clarify that the original intent did not intend to apply to something that didn't exist when it went into place. unless you're going to say everything, which then you're saying flu. Why say COVID? COVID is the hot button issue of the day. That's what you're using to get your foot in the door to not allow this to be required for COVID, for flu, for HPV, for hepatitis, for AIDS, whatever it may be. You are using this, you are using COVID and people's fear of COVID to force this through. So the reason this was put into place was to allow individuals to not be forced. So say a pharmacist to not be forced to make a decision that they didn't want to make. But does the individual have that same right to not be forced to make that decision, to force themselves to do it?
Representative, I'm sorry, I didn't understand the question.
So you're saying an individual has the right, so a pharmacist, a doctor, whoever it may be, has the right to not give a certain medication if they feel that it's not the right thing to do. Does an individual also have that right to make that decision for themselves if they believe it's not the right thing for them to do?
Respectfully, Representative Davidsmeyer, I don't know that that's germane to what we're talking about here. Specifically,
It certainly is. That's the whole point of this. That's exactly what you are trying to clarify. You are trying to clarify something which I don't know that, did they discuss the individual rights during this debate at all? Did they say this does not apply to an individual's right to deny health care? Did they specifically say that?
Representative, at the time of the debates, they talked about a health professional's right, but the act was always intended to be about patient care and limited to items around patient care. So we're kind of talking outside of the scope here.
So only someone licensed to provide care has the right to deny that care. So I'm not licensed as an individual because I'm not in healthcare, right? So I cannot deny healthcare to myself. I cannot say, I don't want that.
Representative, I'm not sure I understand the question.
You're saying my doctor can say, no, that's not right for you, but me as an individual, I can't say that's not right for me.
Representative, I did not state that.
Okay, can you explain why I don't have the same right that my doctor or my pharmacist has?
Representative,
as part of my health care.
I don't think that's germane to the conversation that we're having here about the Healthcare Right of Consciousness Act. So
It certainly is. That's the entire reason that we're having this conversation, because you want the governor, the president want to force people to be vaccinated. They want to mandate people to be vaccinated. So if businesses mandate it, you want the business not to be liable. Who is liable? Because the drug companies aren't liable. Pfizer's not liable. Moderna, J&J, they're not liable. Who's liable if something goes wrong? And they were forced to take the vaccine.
Representative, as we've stated, this does not stop other litigation. If an employee wanted to sue an employer on other grounds, that would be available.
All right, here's what we're going to do here. Robin, you have a statement on this question?
On this very question, there is the vaccine adverse reaction board and on the federal level that deals with all adverse reactions and cases that are brought to it. So there is a mechanism for that.
I'm sure that will comfort somebody that was forced to do something that ended their life. I'm sure that'll comfort their family, that maybe they'll get a few bucks. But at the end of the day, this is a personal healthcare decision. And you are forcing people to make a decision against their will. You either can make a living or you can make a healthcare decision, but you can't make both.
Employers,
in the state of Illinois, at least.
Employers have been able to require their employees to have vaccinations for a very long time.
And and vaccinations that have had many years, many years of history.
And they haven't been in the middle of a worldwide pandemic, so. But, you know,
So how many employers require those
Get out
other
of context,
vaccines?
Representative. You can't take this out of context.
And you are taking it out
We're
of
not dealing
context
in
by
normal
saying you're
time.
clarifying it for COVID when technically you're saying they can't use this conscientious objection for the flu. They can't use it for HPV. You are using COVID. You're using COVID because it's the hot button issue of the day.
That's not true. And you've
Yes,
said
it is. It is completely and utterly true. That's the whole reason why you put COVID in there. So, this is an absolutely ridiculous bill. You're trying to take people's healthcare rights away and pass the liability off to basically nobody.
No,
So-
my goal, first of all, the federal government has liability. And secondly, my goal here is to save lives.
And not allow people to make their own healthcare decisions. I understand.
All right, thank you, Representative Wheeler, for some final follow-up.
Yes, thank you, Mr. Chairman.
We've been going a long time here.
So, yeah, no, we have been going a long time. I don't want to belabor the point here, but I want to say a couple things here based on real people, not just our theoretical version of things here as we're talking about a bill and the language in the bill. So I got reached out to in my office, not by the person who is concerned, but rather by their employer, and it's local government. And this young lady is concerned that she's going to make a decision based on how this bill turns out. Her concern is she has deep objections to the idea of being forced to take a vaccine that she's not confident in or comfortable in, or whatever her case says. I didn't talk to her, so I don't know the specifics of that part of it. But she feels that if we pass this amendment to this bill, that she's going to have to choose between her health care choices and her job. And I've heard this from dozens of people that I know personally. But I'm talking about this specific situation here with a young woman who has her whole life in front of her. She has to make a decision based on what we do here. Now, I'm being told that there are other objections that they can raise. If there are other objections, they can raise. Why do this? What's the point of this bill? If there's already other objections they can raise, I don't understand why we're doing this, why we're taking something away from people here in Illinois that they have now, that they can depend on. That's our job, is to protect those rights. Now, I understand, I agree with Leader Gable. We want people to be healthy. We want them to be safe. But there's a balance here. And there's two sides to this coin, and we're not taking both of them into account with what we're doing right here. And we are rushing this through. People are concerned about the unintended consequences or side effects of a vaccine. Well, we are not taking into account any of the unintended consequences of what this bill says. And the idea that we're going to come out here and say that this is the clarification, this is a whole new language. This is new language, not a clarification. Okay? Let's get over that now. I don't see how we can look ourselves in the mirror and say that that's actually accurate. That's just a way to get around something. Potentially a vote threshold. I don't know. It makes no sense to me to even include that part of it. Somebody's going to have to explain to me how a bill that is so broadly written, I think so poorly written, as far as what the full intended consequence is going to be of this bill, how that's going to comfort the woman I referred to earlier, and how she makes a decision about her life, about her employment, how she takes care of her family. I don't understand why we're putting them in, anyone in that kind of a particular box. We have gone through this pandemic. People have social distance. People have worn masks. Okay, they've taken lots and lots of tests, and now they're at the point where they feel that they have an employer, in this case, government, who requires them to get a vaccine in order to continue their employment. That's the only way forward we've got. I don't understand why we aren't clarifying this more in this bill. If you believe this, why isn't it more clearly written? Help me understand that. I'll take that answer from anyone.
Representative, I think, again, I can state that this bill does not change whether or not an employer can mandate vaccines. It's not what this bill does. This bill is specific to whether or not in court an individual can use the Healthcare Right of Consciousness Act. That's it. So that's my response to you.
Okay. So you said that they can go to other places in federal protections, right? So what is the point of this bill?
The point of this bill is to allow them to use other acts in the federal law instead of using the Healthcare Right of Consciousness Act, because it was never intended for that purpose.
But the act clearly says, at least in my reading of it, and I don't have all the text in front of me because we're all on the same computer screen, that there were protections built into that act that protect the patient from receiving care that they don't wish to receive based on their conscience, not based on a mandate. So again, that was written into the, and we can discuss this after the committee's over, but I believe that that language existed not just for the provider. And maybe I'm wrong on that. We can dig into that more deeply, like I said, but this is what people are reflecting back to us. I mean, how many times do we get a bill that has 45,000 witness slips attached to it? Virtually never. Even on bills that are bigger than the budget, we don't get that. This bill has touched a nerve because so many people are concerned that they're losing their opportunity to exercise their own conscience about their bodies, about their health, about their family. And we are doing nothing in this committee that I can see to alleviate any of those concerns. I'll stop there.
Chairman Rita, I have some two additional follow-up questions.
Two, and then we
All right, you have two follow-up questions?
First,
Question number one.
Ashley, I'd like you to comment on the decision, this Illinois Supreme Court decision, Rojas, R-O-J-A-S, v. Martell, M-A-R-T-E-L-L, 2020 IL App 2nd, 190215, because in that case, it was held that there is an independent right under Illinois law to protect your right of conscience, separate and apart from federal law. So with that, any restrictions that we put on exercising your state rights of conscience is not going to be reconciled by federal law, because the court there found they were two different analyses, right?
Representative, I cannot respond to that because I have not read the case, but I'm happy to read the case and follow back up with you.
Maybe you should. Second, I would also like all of the members of the committee to know that when it comes to the vaccine court, that Leader Gable referred to at the federal level, number one, hard to get into. Number two, extremely high burdens of proof. And most people do not get relief out of the vaccine courts. Third, you are not allowed a right to a jury at the federal vaccine court level. Fourth, there are all sorts of caps in terms of what you can get. Not only, you are only capped at $250,000 for pain and suffering, and your death benefit is capped at $250,000. And that's if you can manage to get over a whole host of congressional hurdles to actually demonstrating relief. So to somehow suggest that the federal vaccine court is going to give you the types of relief that we would normally offer under Illinois legal protections is simply baseless.
We don't have it.
All right, how
We don't
about-
have any legal
Let's get
protection.
to question number two.
Fine. For rights to have teeth, you have to have a remedy. And by getting rid of this remedy, you're essentially denying people a right of access. Now, here's the one thing I'd like to know. If a school, can a school require that as a condition of a student to attend, that everybody in the entire family has to be vaccinated? Because that's going to be a step that will prevent the transmission of COVID-19 in their school?
Representative, to respond, I would just like to say that this doesn't get rid of a remedy because that remedy never existed. I would also like to state that, again, we're not proactively mandating anything. Schools have been allowed to issue mandates, and this legislation does not change that. Thank you.
Well, while you're saying that remedy never existed, go read Rojas, because that course stands for, that decision stands for exactly the opposite premise, that there is an independent remedy, that this statute that you're modifying is the pathway to the remedy for being forced to engage in any medical activity that violates your right of conscience. Thank you, Chairman.
All right, thank you.
Will
Seeing
Davis?
no more.
I'm sorry, it was the Illinois Appellate Court, not Illinois Supreme Court. My apologies.
That was noted. All right, so there's no more questions from committee members.
Let's get cozy.
Representative Davis.
Here I am. Hi. Okay, there's some people can see.
Representative Davis moves that House Floor Amendment number 2 to Senate Bill 1169 be recommended for adoption.
So
Is there
moved.
partisan leave?
We'll ask for a roll call vote.
You'd like a roll call vote? Okay.
Yes, thank you.
Will the clerk take the roll?
Rita,
Yes.
Davis,
Yes.
Wheeler,
No.
Andrade, Bourne,
No.
Brady,
No.
Buckner,
Yes.
Carroll.
Yes, and I'd also like to thank the sponsor. She took a lot of flack this afternoon from some people on social media that it was totally inappropriate. So I appreciate the way that she handled herself with dignity today. So I'm a yes. And again, thank you, Leader Gable, for being above all of that stuff.
Davidsmeyer,
No.
Evans,
Yes.
Gordon Booth,
Yes.
Hernandez,
Yes.
Ramirez,
Yes.
Spain,
No.
Mazaki,
No.
and Representative Andrade. I did not hear the first time.
Yes.
Thank you. That is 9 in favor and 6 opposed.
All right, so we got 9 voting yes, 6 voting no, no one voting present. Senate Bill 1169, House Floor Amendment number 2, will be reported to House floor. Seeing no further business, we are going to recess to the call of the chair.